So thank you all for coming today. I'm Dr Nicola Beamish and I come from the Tasmanian Vaccination Emergency Operations Centre, which is just a fancy name for the Tasmanian Vaccination Rollout Team. We have come today to talk to you about vaccines, but particularly I guess about vaccine hesitancy and any questions you have about getting vaccinated. There's a few slides, and so I just wanted to talk to you, to ask you as I put each slide up whether you're interested in that slide or whether you're like, no, we're all over that, we've heard that 10 times, in which case I won't bother to go through it again. And I don't have the slide mover forwarder, so Rosie, if you could move forward, that would be great. So the first thing to talk about a little bit, which isn't to do with vaccines, which you can see are right on the end of this image that I've got, is about the public health and government strategy that we have to keep people safe through COVID. So this is a model called the Swiss cheese model, which basically just explains to you that every layer of defence we have against infectious diseases that we don't have a treatment for has holes in it, and so sometimes the virus or the infection slips through. So it's really important that we maintain these multiple layers of defences against COVID. And some of those responsibilities are personal, things like staying home if you're sick, or wearing masks when you're asked to, or keeping your hand hygiene up. Some of them are more to do with shared responsibilities, such as keeping workplaces safe, using quarantine and border controls, and in this case, vaccines as well. So I just wanted to kind of say that, and I might come back to that at the end of the talk. I think that makes sense to people now. We've been through over 12 months of COVID. Prior to COVID, we really hadn't had a situation where we needed to put any of these strategies in place for a very long time, at least in Australia, possibly right back to a polio outbreak, which was in I think the 30s or 40s. Don't quote me on that though. And we'll move along, Rosie, thanks. Do you guys want to know about vaccine development? No? There's one no?
Yeah. Of course you will.
So there's one no and one yes, so should we go with the yes? Yes, we'll go with the yes. So just really this slide is just to explain to you how vaccines get developed. So the vaccine development process is quite robust, and we've had in place for a long time developing a whole lot of different vaccines. What's different about this vaccine is the speed with which it's happened. So you can see from on the left-hand side, the global snapshot, that we started with around about 184 vaccines of potential interest that were checked in preclinical trials. So that just means not in people. And of those vaccines, 88 got through to the clinical trial stage. So the clinical trial stage is that phase 1 and 2. It's pretty hard to see that overhead. Can you guys actually see the phase 1 and 2?
My eyes will go in front of it.
Yeah, no, it's a little bit light, isn't it? So phase 1 and 2 is about checking, trials is about checking the safety of a vaccine. So the vaccine is then tried on a very small number of people, but it's also to check that you get a good immune response to a vaccine. And those trials tend to happen on around about, well, often much less than 100 to start with, but around about 100 to around about 1,000 people. And if we think that a vaccine is safe, then the vaccine will get developed to the next stage. The next stage is larger clinical trials, which again look at safety, but they also look at effectiveness of the vaccine, so not just immunity, but how it responds more in a natural world situation. And in the case of COVID, trials have been done on upwards of about 40,000 people across the world. After that, the vaccine needs regulation, so it goes through an independent review process where governments and government agencies, expert government agencies, make decisions about vaccines, and then it comes to release. And I think the thing important to say about release is when we release vaccines or any medications, although we have a good idea of safety and effectiveness, it's not until we put them into the population and we start using them in millions of people that we see some of the rarer complications of medicines and vaccines. So that's what we're likely seeing in the case of this TTS syndrome, which I'll talk to you about later, which is the clotting syndrome. You don't see it in those smaller groups, even when you're testing it on tens of thousands of people, you don't see those really rare adverse reactions. So it's a really robust process. It weeds out a whole lot of vaccines, and at the end of that, worldwide, we've just got to 4 vaccines. Okay, any questions about that before we move on? Okay, we'll move to the next slide. Thanks, Rosie. So we have Pfizer and AstraZeneca in Australia. You guys know that, and possibly Moderna coming later in the year. And we'll move on quickly. Does anyone have questions about why we've prioritised vaccines in different groups? Or do you feel like you already know that? That we've vaccinated some people earlier and some people later?
Just a high risk first.
Yeah, that's exactly right. Yeah, so the first one up is that if you're at high risk of either developing the illness because of the place you work in, so quarantine and border staff are a good example of that, or if you're at high risk of becoming ill with a vaccine, with an illness, then you get the vaccine first. And the other group that we've prioritised is people who are critical to keeping our society running. So, you know, we don't want our power and our water and our roads to stop working. We want to have food to be able to put on people's tables. So all of those things, we want to be able to have emergency services working. So all of those groups of people have been prioritised. We might move on to the next one. So this is just the rollout. Anyone who's been on the COVID TAS website will see it's a phased rollout. It goes from high risk people that are high risk of contracting the illness or high risk of becoming unwell with the illness to people who are lower risk. And you'll see the phase 3 is going to be under 18-year-olds. So that's something that's been considered across the world now. What age can we safely vaccinate children with COVID? Where we're at the moment is we're just heading into phase 2A. So that's younger adults, younger Aboriginal and Torres Strait Islanders and the critical workers. So I'm just looking around the room and thinking that most of you might already have been in an eligible phase for rollout or be getting there very quickly. Yeah. This is a pretty simple slide, most people know this, but where can you get vaccinated? So you can get vaccinated by your general practitioner if they're participating. You can get vaccinated in Aboriginal community controlled health services, which in Tasmania is the Tasmanian Aboriginal Centre. If you're an Aboriginal, Tasmanian Aboriginal person, you can get vaccinated in state government clinics, also respiratory clinics, I didn't put that on there, and you can get vaccinated via the federal government rollout if you're in an aged care residential facility or a residential disability service. Any questions about that one? No. Do you want to know how to book a vaccination, or is everyone all over that? Yeah. Okay, we might move on from that one. So common side effects, this is probably why most people are here. So the really common side effects are the ones I've listed, and they are kind of in order of commonness. So the top one, pain in your arm, is the most common, down to feeling sick in your stomach is the least common. Half of the people that are vaccinated with COVID get no side effects whatsoever, and in fact that worries people. My husband had an AstraZeneca vaccine about 2 weeks ago, and the next day he was like, is it going to work? I don't feel sick at all. So we know that side effects and it working isn't related at all. So if you get no side effects, it doesn't mean that the vaccine worked. It just means you got lucky and you were the one of the 5 in 10 people who didn't get side effects. Most of the side effects are mild and they pass in 1 to 2 days. And we have found anecdotally that about a third of people who are at work and going to work the next day need to take a day off. So we are a little bit careful with critical and essential services not to get whole staff populations vaccinated all on the same day, because we want the emergency department staff to have enough people to staff the emergency department the next day. All of these side effects are mild and will pass, but you can feel a bit poorly the next day. Did you have any questions about the common side effects before I move on? I will come to the more serious ones. But
are the side effects the same with AstraZeneca and with Pfizer?
They are pretty much the same. They're in a slightly different kind of the way that they react. The commonness of them changes a little bit, but they're all pretty much the same. Yeah.
Is it possible just to repeat the question?
Oh yes, the question was, are the side effects the same? Were you another question, or are you just going to tell? No. Okay.
Just for the people at home.
Yeah.
Would the side effects be reduced in the second injection?
So the question is, would the side effects be reduced in the second vaccination? Not always. Sometimes.
So you don't get desensitised by the first one?
No, sometimes it's the other way around. Some people are finding they have a few more side effects with the second vaccination. That tends to be particularly with Pfizer, particularly in younger people. But that's anecdotal. That means I'm not sure that's evidence-based. It's just what we're finding. AstraZeneca, I don't think there's that same experience that people have had. Yeah. Any other questions about common side effects? No? Okay. So how does the vaccine rollout monitor for side effects? That heading was a bit messy, but I mean, how do we monitor for side effects in the vaccine rollout? Are you guys interested in knowing about this? I feel like this is a really interesting and important part of the talk, so I might go ahead anyway. So I think the first thing to say about monitoring side effects is that we have a really world-class monitoring system in Australia, and we've bumped up our monitoring system since we've rolled out COVID, knowing that it's a new vaccine and that we need to collect more data than we ordinarily would. So we have an excellent side effect or adverse outcome monitoring system in place, and that happens in all of the states. And we collect our data in two ways. One is that if you have a vaccination and you have a side effect from it, you might put a form in yourself saying, I have this side effect, or you might go to your healthcare professional and they might help you put that form in. That form then comes to the Tasmanian government. It also goes to the TGA, which is the Therapeutic Goods Administration, and we have a look at the side effect and we make a determination about the seriousness of the side effect, the likelihood of it having been associated with vaccination, and whether any action needs to be taken related to that side effect. The other way that we're gathering data is that we register people, if they want to, people can register with AusVac Safety, which means you get a text after your vaccine asking you how you're going, and you get that text at day 3, day 8 and at 6 weeks, just to see if you can tell us if there's side effects that you're getting, and we tend to be picking up the more common side effects with that. I feel like I'm getting a lot of feedback on this speaker, sorry.
Are people told about that when they have the vaccine?
The AusVac Safety
about
checker?
whether to report side effects?
Yes,
Because
yes.
my husband didn't know.
They should be being told that, yeah. There's lots of information on the COVID TAS website about it too. So I've popped the links in the next slide. So I think that's an important question. I can certainly feed that back to our team, that it is important as people leave that they know where they go if they get side effects. I would have assumed that it's on the information sheet that you're given, but I would have to look at that information sheet to check if that's the case. So you can register it in your state or territory, or you can register it with a federal advisory contact. We have another question.
I was just wondering why you just couldn't fill in a quick survey as you went for your second injection on the side effects of the first.
That would be sorry, the question was could we survey people on the second jab? That would be an excellent idea. It's not how we're doing it.
Survey.
Yeah, to see how people have got, and we haven't been doing that, but we have been using the AusVac Safety online system and the texting system, but it's a great idea, yeah. So the important thing to tell you about side effects is that we monitor for all side effects. It's not just serious side effects that we monitor for. And if you see this chart here, what you can see is that per 1,000 doses, we're seeing around about 8 people reporting side effects. And the vast majority of those will be mild and self-limiting and not require any medical attention. We're sitting a little higher than some of the other states. You might have noticed if you have an eagle eye. We're actually really pleased about that, because that means people are contacting us and telling us about all of their side effects, not just some of them. I don't think it means that we're getting a higher percentage of people with serious side effects. So this is how you tell someone if you have an adverse event after vaccination. So you can go to an online form on the coronavirus website, or you can do it through the public health website where we have a reporting adverse events following immunisation, or you can contact the public health hotline and speak with a clinical nurse who can fill in that form for you essentially. And getting the form either can be emailed or faxed, but usually that's something that health professionals are doing for people. So what about the clotting illness after vaccination with AstraZeneca? Did any of you not have a question about this? This seems to be the thing most people are worried about. Are you happy for me to go through that?
I do have a question.
Yeah.
But do you want to go through?
No, there's someone behind raising their hand.
It was actually a question back a little bit.
Oh, should we go back the slide?
It was about the comparison of side effects and common side effects to, I guess, other vaccinations that people would
Yes.
get.
Yes.
Like a flu vaccination
Yes.
or a measles and mumps.
Yeah. So the question is whether the side effects for the COVID vaccine are different, more or less, than other vaccines. And that is a question that I cannot answer because I have not looked at the evidence base of that. But I would say anecdotally, if you kind of rate it, all vaccines are different. If you guys have been getting regular flu vaccines, you'll know some years you get a flu vaccine and you feel terrible for 24 hours. Some years you don't even notice. But some vaccines are very reliable in their side effects. So for example, when you have a tetanus injection, which you'll often get with your whooping cough, you get a really sore arm with that vaccination. So in terms of rating it, it's very, very variable person to person. But it would be not dissimilar to flu vaccination in terms of the likelihood of side effects. That's not an evidence-based opinion, that's my anecdotal kind of experience of seeing lots of people having vaccines. Does that answer your question? I could probably ask our specialist medical advisor that question when she gets back from holiday and she would have a really good scientific answer, but I don't have it. Okay, so this is a clotting problem. It's called thrombosis with thrombocytopenia syndrome. Thrombosis means a blood clot and thrombocytopenia means low platelet counts. So the platelet counts are the little cells in your blood system that help you clot, and it's this very strange phenomenon where you have low platelet counts, which are usually the things that help you clot, but at the same time you're clotting. So it's quite a hard one to understand. It's a very rare illness after vaccination, and it is a new illness. We haven't seen it previously in vaccination. So what we're finding is that it's more often in under 50s, so we're seeing it a bit more commonly in the under 50 population. That's why we've made some changes to the advice about the use of AstraZeneca. It's not a clotting problem like other problems that people commonly have, so it's not leg or lung clots or clots in your veins, and it's most likely caused by an immune response to the vaccine. It is a condition that isn't determined by anything that you've had before, except for a few very rare conditions that we think might predispose people to it. So the only thing that we can find that predisposes people to it is being younger. Cases tend to occur in the first dose. We've very, very rarely seen them in the second dose. And we've had 20 definite cases in Australia and 3 possible, and that was from the end of May. And other than sadly one case, which I believe was the first case, all of those people have survived and are stable, recovering most of them out of hospital. It's a condition that now that we know about and the healthcare service is really primed now to pick it up, we're getting people into hospital treated very quickly. They're not tending to end up in ICU or very, very poorly. They are sick, but they do get better. Does anyone have any questions about TTS? Yeah.
Well, I have it. Yeah. I know that it's different to the normal clotting process, but I have a question about anticoagulants, and I have read that it's absolutely fine to continue your anticoagulants if you have AstraZeneca, but I'm about to have surgery, and I'm going to be quite immobile for a while, and I may need an anticoagulant like Taxane. So if I have it within that 28 days after AstraZeneca, it's not going to put me at risk of...
So the question is, what happens when you have some complicated medical things going on around surgery and a risk of clotting around that time and need to be anticoagulated? And that is a very complicated question, but I'll make some simple kind of population-based suggestions about that. One is that you're right, that you can have the vaccine and be on an anticoagulant. The only risk that we see in people who are on blood thinners is that they might be slightly more likely to bruise at the injection site after they've had their injection. So we tend to get people to apply pressure to their arm for 2 to 5 minutes afterwards just to prevent that. In terms of the immobility and the surgery and having the vaccine and the timing of it around all of those other complicated things, it's very important that you seek your own advice from your own doctor who knows your health history and can give you individual advice. One of the things in public health that we don't do is we're not here to provide individual advice to people. We're here to think about population health and population safety, so we have to be careful not to offer individual advice to people. I think the next slide, Rosie, might go, oh, it's not there. Can you just flick a couple forward? So that's the one, sorry, back, yeah, that's it. So just going through, because I would kind of jumped ahead. So who can have AstraZeneca? Anyone over 50, and that does include people with a history of blood clots in common places like legs and lungs, an increased risk of blood clots in common places, a family history of blood clots, so you're getting the pattern here. All of these people are okay to have AstraZeneca. A history of heart attacks or strokes, so we have found no association between the clotting problem and heart attacks or strokes. Low platelet counts past or current, and the blood thinners that you were talking about before. Okay? We might just flick back, Rosie, and one more back. Yeah. Does anyone else have any questions about TTS? No? Okay. That must be the least questions I've heard about TTS.
Symptoms, I suppose.
Yes, I didn't go through that at all
today.
today.
Headache and abdominal pain.
So we're tending to see people become quite poorly about 4 days to 20 days after vaccination, and it does tend to be with things like pain in the tummy, pain in the head, sometimes some signs on your skin that you've got a bleeding or clotting problem. And most people who get it will end up quite quickly in hospital because they are very unwell. Does that answer you?
And treatment?
Treatment is complicated and best undertaken by specialists in haematology or immunology, but it is essentially supporting the person to recover with the addition of some medications that help their immune system settle itself down and allow the immune system to settle and the clots to resolve.
And it's not treated with anticoagulants?
No, it's not. That's correct. So the question was, sorry, I didn't repeat the question, what the treatment is and is it treated with anticoagulants?
Yeah. So how do the clots resolve if there aren't anticoagulants?
No, so the question is how do the clots resolve? They just absorb themselves. We know that clots in bodies most of the time absorb themselves. They take a little bit of time. The body's very good at kind of making pathways through clots and what we call recannulising. That just means letting the blood flow back through the vessels that have been blocked. Yeah. With a bit of help sometimes from treatment. Okay, so why is AstraZeneca only for over 50? So this slide's a little bit complicated, but essentially it just explains to you the potential benefits and harms of AstraZeneca. So the expert advisory bodies who looked at this looked at data and they considered the concept of an idea that you would be in an outbreak and they would look at ICU admission in the 16 weeks after over a 16-week period. And essentially what they found was that the potential benefits as you get older of AstraZeneca become much, much higher. So you can see the numbers of people growing in those age groups, or you maybe can't see it because I can see people squinting, it's fuzzy and a bit faint. On the other side, the potential harms are higher in young people. But if you were in a second wave of COVID, you would still be much safer to be being vaccinated at a lot of those age groups than you would to be unvaccinated. So the advisory body has set a very, very careful cut-off of 50. But if we were in an outbreak of COVID, that may well change. The guiding body may say, look, the benefits of being vaccinating everyone of all ages with AstraZeneca are actually now higher than the risks. So just for everyone to be aware, this is a point-in-time decision that the advisory body has made about AstraZeneca, and that may change. We very much hope we're not going to get into a big outbreak in Australia. Did everyone understand that slide? Was it a helpful slide? Because I like it, but a lot of people have said to me, oh, it's a bit complicated, and I got some nods there. Yeah. Okay. So who needs to have Pfizer? So people aged 16 to 49, people with a severe allergy or anaphylaxis to the other vaccine, people who've had the TTS syndrome with the first AstraZeneca vaccine, and then these 4 very rare medical conditions that we're getting really used to asking people about. They are the only contraindications in terms of your medical history for having AstraZeneca. I'm not going to read them all out because they're long and very medical. you would know if you had one of these conditions.
How do you know if you've got an allergy to the AstraZeneca until you've had it? So that obviously you have it and then you realise.
Yes. So the question is, how would you know if you're going to have an allergy to AstraZeneca? The answer is you're not going to know till you have it. And that's the case with any new medication or vaccine that you try. So that's why we have the period of waiting time after you have your jab. So you need to wait in the clinic, being observed by medical staff for 15 minutes afterwards. If you have particular sensitivities to allergy and anaphylaxis related to medication, sometimes we keep you a little bit longer. But it's really about accepting that with any new medication, in fact, any new anything, you might rub a cream that you've never used on your skin and get an allergic reaction. You might eat something you've never eaten before and get an allergic reaction. So it is just about watching and waiting people for that critical time when we know anaphylaxis is going to happen, which is those first 15 minutes.
So your second vaccination can be the different one than the first one?
If you'd had an anaphylaxis, we would recommend that you'd be having a different vaccine the second time. And at the moment, we're just talking about AstraZeneca and Pfizer, but I can imagine that in the next year to 2 years, we're going to be talking about a whole other group of vaccinations, and that people might get different vaccinations in different years. As, their boosters might not be the same as the vaccine they got the first time. So just bear that in mind.
Also, both my kids have allergies and have EpiPens to different things. Is one of them better than the other for people that actually have a lot of allergies anyway, to start with?
So the question is about allergies and which vaccine is indicated, and there isn't any advice about allergies and asthma and intolerances, other than that both vaccines are okay. Obviously your kids are under 50, so at the moment they wouldn't be recommended to have AstraZeneca. But it is a matter of going to your local doctor and talking to your doctor about the risks. What we're tending to do in the clinics is keep people a little bit longer if they have an allergy history. Not always, but for particular allergies. Were there any questions about that slide that we just had up before? You didn't want to talk about 4 rare conditions, which I know almost nothing about because they're so rare. That's good. So in terms of getting vaccinated after you've had the COVID test, I put this up because this is a question we get asked a lot. And the answer, I put it up there, is yes, yes and yes, with one small exception, and that's the 2 days after you have your vaccination. So over on the side closest to me, the first 2 days after you have your vaccination, I have fever, tiredness and headache. Do you also have a runny nose, sore throat or cough? If you do, then you do need to get a test. We don't think that the vaccine causes the upper respiratory tract symptoms that COVID causes. So in this case, if you were unlucky enough to have a vaccine and then contract COVID and show the symptoms, we would want you to be tested because you may have COVID. And that has happened a little across the world in places where there's more COVID. So very important if you have any respiratory tract symptoms that you always get tested for COVID, even immediately after your vaccine. If you don't have those symptoms in your nose, throat or chest, then you actually don't need to get a test as long as those symptoms pass within the first day to 2. And the rest of the time, if you have a fever, tiredness, headache, runny nose, sore throat, cough, you always need to get tested. I've just put a little note in here that we know that the COVID vaccine works to stop severe disease. We've got some good robust data across the world about that now. What we don't know so much about is whether you might still contract a mild COVID where you get the common symptoms of COVID, and whether it's going to stop you spreading it to other people. So that's why I put the little Swiss cheese model back in the middle, just to remind you that even when you're vaccinated, even when a lot of the community is vaccinated, it's really important that we have that idea. Probably through this pandemic, we're always going to need to maintain some of those other strategies to keep COVID at bay. So this slide's about vaccine hesitancy, and I haven't got a lot of slides about this because I thought it was probably just better to talk about. Did anyone have any questions before we move on to what happens if I'm feeling anxious about having a vaccine? No, you're all fine. So this is just a kind of picture about where people fall in vaccination, their readiness to be vaccinated. And essentially it tells you that some people are on the far end, saying that they will never get any vaccines for anything. And a lot of people who are in that situation have particular religious or ideological beliefs about vaccines, and they will not ever get vaccinated. There are a small group of people. On the other end are people who would readily accept any vaccine that was offered because they believe that vaccines are safe and effective and that everyone should have them. And I have to say, most doctors probably fall into that end because we understand the population benefits of vaccination. The vast majority of the population fall in the middle. That maybe they're not sure, they're a bit hesitant, that they might refuse, but they might change their mind. They might just wait and see. And that's where a lot of people we're finding are falling with COVID vaccine. I don't know if any of you've got any questions about that or would like to tell me about kind of where you're at with vaccine hesitancy. You don't have to because you are on record, but...
I have heard people say that, and even people that are well educated as far as vaccines, that they're not quite ready. They don't think that there's been enough research yet, enough time to determine whether there are even longer term side effects.
Yes.
So what would you say to those people?
I would say to them that you have to make your own decision about when you get vaccinated, but I think Melbourne's really opened up eyes to the fact that in Australia there remains a very real threat of COVID, and that if we were in a situation where we had a lot more COVID in our community, what we find is the hesitancy tends to fall. People are like, you know what, I was going to wait, but now I'm worried. So it's all about kind of the balance in your mind about the risks of COVID versus the risks of vaccination. And I would encourage people to seek, good information about vaccination. The unfortunate thing about COVID vaccination is we've gone into this kind of world where there's been a lot on social media and a lot in the media about the safety or otherwise of vaccines. And it's a bit of an echo chamber what happens in the media, so you kind of hear the same story over and over again and it gets bigger and bigger. And that's been quite unfortunate because it's scared people. But we do think that the checks and balances around the vaccination are in place. But people do need to make their own choice about it, and we know that it's really normal to be hesitant, and it's really important that you get someone to talk to about how you weigh the risk, how concerned you are about which parts of the vaccination process, and what you know about the vaccination process and the side effects. So that's kind of where we get to with that. I'm not sure that, there is one more slide. So one of the things we're wondering if it was worth talking about today was whether if you've come, we were talking just at the beginning of the meeting about how there's more women here than men today. So if you were coming because you were worried about people in your family not getting vaccinated or getting vaccinated, how would you talk to them about it? Is there anyone who's interested in knowing the best ways to talk to other people in their friendship group or their family about vaccination? Yeah, okay. I do have a little helper at the back, Danielle. So Danielle and I thought we might just go through a bit of a role play. But while you're listening, just have a look at those boxes. So the important things is to listen to what people are saying, be curious, try and avoid judgment, and try not to say you don't understand what you're talking about. So we're going to have a little chat about it. So we'll just use our own names because I hate role playing where you have to get into role. But we were thinking, Danielle, that we were friends, is that right? So I am not going to be a medical practitioner for this because that's not going to help you understand how to talk to your friends and family. So Danielle, I hear you're a bit worried about getting the vaccine.
Yeah, I am, Nikki. One of my family...
We're not going to be able to, Mike, do you want us to change?
If you could just point it, yeah. One of my family interstate and here were really concerned, and they said that I shouldn't have the vaccine because they were really worried that I was going to die. So now I'm concerned, I'm not sure if I should get it.
So when your family member said that, were you planning to get the vaccine and you changed your mind?
Yeah, well, I wasn't really sure. I'd heard lots of things on the media about it, that lots of people I know have had it and haven't had any real side effects, but I'm not sure about me. Do you think I should get it? I don't know.
It's a really hard one, isn't it, when you're not sure about whether something's going to be effective or safe. How have you gone about finding out information other than obviously your family member was very negative about it?
Oh, I've heard things on the radio, like I think there's some website that I can go to look up information, but I'm not really confident on computers. But I've heard things on the radio too saying really positive things about the vaccination, that I should get it, and I'm actually eligible now because of my age. So what do you think?
I'm wondering if finding someone who you trust with the right kind of information, like whether that's like a healthcare provider or do you have any family members who kind of, you trust and maybe know a bit about health and well-being? Maybe they're the people to talk to.
Yeah, that's a really good idea. I've got a sister who is a GP actually. I should have gone to her. I didn't really think about it. But I suppose I could talk to my doctor too. I see them fairly regularly. So yeah, that's a really good point.
And I'm wondering too if you've got other people in your family who could help you get online, because there's heaps of good information on the coronavirus websites in Tassie and in Australia. So some of it's quite easy to read, some of it's a bit complicated, but I wonder if that's a good way to go too. While we're talking, do you think there's anything that would change your mind about how ready you are to be vaccinated other than information?
I think knowing other people around me have got it is good, and I think that's helped to persuade me that I'm really pushing towards actually getting it. I think talking to more of my friends about it might be a good idea as well. And I think as well, thinking about the risks and the benefits, and I know now that there's a lot happening in Victoria and there's an outbreak, and so that's really concerning me, and I'm sort of tipping one way or the other. But in Tasmania, we haven't had COVID for ages. So should I get it now or should I wait?
I've been thinking that we're in a bit of a bubble here in Tasmania, aren't we? We're all kind of feeling like maybe COVID has passed, but I do feel like with Melbourne, I'm like, oh goodness, it hasn't passed. This is still quite serious. I don't know. I don't know whether you wait or not. I feel like that's your choice, but I can understand how you feel, that you're uncertain about that. Yeah, good to talk.
Yeah, thanks for educating me a little bit more about it. It's good. And I think I might now go and talk to my GP and help them, get them to help me make the decision. Yeah. I think it's good to have a chat, especially about my own medical conditions and whether it's a good time now for me to go ahead.
We'll finish there. What did you think of our little role play? So we have a message for people in the Tasmanian community that's don't wait, vaccinate. And I think that Danielle really nicely portrayed that kind of thing of, do I wait? What happens if COVID does come back here? If I've got a booking, how long will it take me to get in to be booked for a COVID vaccine? But our message is that the threat of a COVID outbreak across Australia remains real, and don't wait, get vaccinated. And I'm going to finish there. But I'm happy to talk afterwards if you want me to. Thank you very much for your time.
Thank you.